Good morning, everyone. It's really great to see you, and I'm so delighted to welcome you to day 2 of the NIH FDA Nutrition Regulatory Science Workshop. My name is Jill Reedy, and I'm Chief of the Risk Factor Assessment Branch at the National Cancer Institute. Yesterday, we had really incredible presentations and discussions to help set the stage on FDA responsibilities and NIH research to help inform nutrition regulatory policy and decision-making. This really allowed us to reflect on the past and where we are now. We had examples from partially hydrogenated oils, the opportunities with the NIH FDA tobacco regulatory program, the challenges and opportunities that we see with ultra-processed foods, the methodologies for incorporating nutrition science into risk analysis and food policy, and impact analysis and implementation related to nutrition regulatory action. And this is now set the stage for where we are today with day 2. Today, we're excited to build on that and have more discussions as we consider what's possible for moving forward together, as we consider the opportunities for NIH research and FDA regulation. So with that, I'm happy to turn it over to my colleague from FDA, Dr. Hermansky, and we'll move forward.
Thank you, Jill, for that excellent recap. Good morning. I'm Steve Hermansky. I am a Senior Science Advisor in the area of toxicology and food chemical safety with the Human Foods Program of FDA. What a great day yesterday. We talked about a lot of really challenging areas where we're going to spend some time. We're going to learn about how we're going to work together and move forward. And today, what we're going to do is we're going to advance that. We're going to look at, instead of looking at new challenges, we're going to look at some existing resources and some things that we can look at to get together. We have a little over a half of a day left of presentations and discussions, and I'm sure it's going to be all as much as anything as was yesterday when it comes to discussions and presentations. So we're looking forward to it. We will start today with a discussion of databases and research resources used to inform nutrition regulatory science. This will be followed by a horizon discussion on technological innovation in the area, and we will wrap up by pulling it all together with some reflections on the context of our science. Doctors Andrew Bremer and Robin McKinnon will end the day with some overall thoughts and summary of the 2-day workshop. Note that we will have a 20-minute break during the morning session today. So the speakers in our first session is going to be current databases and other research resources to inform nutrition regulatory science. We want to remind virtual attendees to use the Q&A function in Zoom to ask questions during the presentation. Those of us in the room will hold our questions until the end for the discussion. The speakers today will be Shuwen Ng, the University of North Carolina, Gillings School of Global Public Health, Alan Simon, the National Center for Health Statistics, Centers for Disease Control and Prevention, Lisa Harnack of the University of Minnesota, Kyle McKillop from Agricultural Research Services, the U.S. Department of Agriculture. Dr. Kirsten Herrick will moderate the discussion at the end of today's session. She is the program director at NCI. So with that, Shuwen, let's move forward.
Hi, good morning, everyone. Thanks so much for this invitation to talk about some of the databases that our group has been working with the past, actually 15 years. So the rest of the panel will talk about the databases that they oversee and that they work on a lot together. So I'm not going to spend much time at all, any time at all, talking about this. I just want to mention that there are also all these other resources. I will be focusing my presentation on commercial databases, and these include sales data either at the household level, such as from companies like Nielsen IQ or Kantar, as well as point of sales data or transaction data, sometimes through companies like Circana, for example, and often you can also, if you're able to work with some specific retailers, get the retail chain data as well, which I've done as well. And then on the other hand, you also need to have information on the nutritional content of the products. So we also get data from companies like Mintel through their global new product database, as well as Syndango. This was formerly Gladson, and Nielsen IQ label insight data. So these are some of the commercial data sets that our group has worked with for several years now. So how do you use these data to monitor changes over time of our food supply and what people are buying and hopefully, probably, we're assuming, consuming? So I mentioned these types of data sets, right? So let's talk about this, particularly the purchase data, which is what our group works with the most in many countries beyond just the US. We're doing this work also in Mexico, in Chile, Peru, Colombia, Brazil, South Africa. So this is work that we're doing in several countries and certainly have learned a lot of lessons along the way. So I've mentioned the purchase data, right? This comes at the household level, and it's at the disaggregated level. So it's every single barcode that people are reporting purchasing in every shopping episode. We know what types of store they go to. We know when they did it, when they did the shopping. And also we have annual demographic information about these households, household composition, educational levels of the head of the household, for example, and income as well. And then on the ingredient and nutrition database side, I've already mentioned the secondary data from the companies. But in many cases, particularly in the other countries we work in, we do primary data collection. Actually, I would say it's our collaborators, research collaborators in those countries that do the primary data collection. We train them on a protocol on how to do this. So it's standardized across all the countries we work in. And they go into stores to collect images of the products. And then the data is entered into a database. So then what do we do with this data? The first step is to do some data cleaning and preparation. So we have to apply several quality control steps for both forms of data. I'm not going to have time to go into detail on what all of these steps are, but this might be a good thing to say for the Q&A. And then basically, we will then merge the data with each other, right? And it's not so straightforward of just using, let's say, the barcode to match, because there are a lot of products for which we may not have, that are sold that we may not have nutritional information on. So we have to use a bunch of other attributes about the product, the brand name, the product description, ingredient list at times as well, and start to make, to populate and to maximize the matches as best as we can. And so as we go, we have to make some broader and broader assumptions for the items where we may not have nutrition information on. Also, the other piece on the matching protocol that's important from a monitoring and policy evaluation standpoint is a time period. So what data does this, what time period does the data represent, right? So on the purchasing side, you know when people bought things. On the nutrition label side, you need to understand when that product was in the market, right? And you need to make sure that the matches are also time sensitive. So this is where then understanding the policy that we're evaluating is important and we discuss with our collaborators on what are the relevant time periods for the policy in question that we're evaluating, and then come up with matching rules in a time-sensitive way that matches the research question. So this is all based on discussion and it's research question specific. Okay, and then after we link the data, we have to review it. So we don't assume that it's all fine and good. We actually take the time to review and make sure that things make sense. So we have a bunch of programmatic flags built in to verify that what we're seeing is logical. And then we also do manual reviews if we're seeing problems, start to identify some patterns, and then do some additional programming to fix those issues. This is an iterative process that will then lead us to our final analytical files that we use for evaluating the policies. Oops. Sorry, clicked too much. Okay, so what do we use this type of data for? This is a paper that just came out yesterday where we wanted to look at what would it mean if the FDA used what we think they will be using for their nutrient profiling model in the front of pack labeling, which is the 20% daily value cutoff, compared to other regional nutrient profiling model in the area, right? So Canada, US, what we think FDA will use is in the blue. The Canadian nutrient profiling model is in orange. And then in gray is the Chilean nutrient profiling model for their food law that came in 2012. And the PAHO regional nutrient profiling model is in yellow. So first thing I want to say is that all of these estimates, some of them might look a bit scary. For example, for foods, you see like 70, 80% would have a warning label if warning labels were used. But these are all overestimates, because if these policies were put in place, industry will reformulate, right? So these are going to all fall. These numbers are all going to fall. So that's a caveat you should all keep in mind. And then the other thing you'll notice is that the FDA 20% daily value has the lowest proportion of products carrying a high-end label relative to their established regional nutrient profiling models, especially for food. We basically conclude in this paper that there is a need for different nutrient profiling model thresholds to account for reference portion sizes, such as what Canada does, and also to implement stronger thresholds that get stricter over time because of reformulation. Okay, Maya already presented this slide yesterday. I just want to highlight again that 16% difference in that blue using the classic HFSS definition compared to approach number 5 at the bottom, and that we can actually get very close already to approach number 5 if we were to add either just non-nutritious sweeteners as part of the definition or flavors and colorings. These data sets are also useful for setting targets. So this is an example from the New York City Sugar and Sodium Reduction Initiatives. And we can use this to study the presence and the amounts of non-sugar sweeteners in some countries. So in Chile, for example, they actually require that companies report not only the types of sweeteners in their products, but also the amounts of the sweeteners in their products. And so we are able to look at before and after the front of pack labeling regulation, how the products reformulate. And basically you'll see in 2011, before the policy, no non-nutritious sweeteners. And then after that, they replaced sugars, because sugar warnings were one of their labels, with non-nutritious sweeteners. And you see these sweeteners show up, sucralose, stevia, and the amounts. So we can start also measuring the exposure that people have to different types of non-sugar sweeteners and whether or not sweetness is actually changing over time. By the way, in Chile, we didn't find that sweetness changed. Sources of sweetness changed, but overall sweetness did not. We can also use these data to look at on-package marketing, such as claims, all kinds of claims, as well as child-directed marketing. So in the previous slide, you saw the puppy, dog, cartoon. And so those are forms of child-directed marketing. And of course, we can look at this data to look at shifts in the distributions, as well as differences or disparities by socioeconomic status. We can use this data as well to compare how the US is doing compared to other countries. Here's an example of the US versus UK of the exact same product and the ingredient list. You see very different types of ingredients being used. And then also another example, much shorter ingredient list in the UK version, and basically no additives. We're also starting to use this data to look at what does it mean for health outcomes. And we can link it to electronic medical records. So here's a study that I've been involved in, looking at a produce prescription program where we're recruiting patients through federally qualified health centers. And so we match them to control patients not getting this $40 a month benefit, and to see how their health measures are changing. And because we also have information from the retailer that's participating, we can see how these participants' purchases changed. And we can start looking at those response, looking at redemption, changes in the nutrition profile of their purchases, how long they're in this program, and then also their household size. And then another example is from Seattle. Alumni of our group led this work, looking at the sweet beverage tax there on BMI of kids in 2 healthcare systems, and basically found greater reductions among the children in Seattle exposed to the tax. We can use this data to monitor other things like packaging materials. And then I think that it's important to also start thinking about how we can incorporate AI into both the data management process and analysis. I don't have time to go into depth on all of this, but I'm happy to keep chatting about this. I'm looking forward to the next session as well on technologies. Thank you.
All right. Hi, everyone. I'm Alan Simon. I'm the director of National Health and Nutrition Examination Survey, or NHANES. Let me see. Oops. Try this. No? There we go. Most of you probably know what NHANES is, but just in case there are a few of you out there that don't, I'll give you the general idea. So we're a nationally representative cross-sectional health study, like a survey, like many other surveys. But what makes us unique and different is that in addition to interviews, which we do in people's homes, we then bring them out to mobile examination centers where we can do exams on them and get blood and urine and things like that, giving us really unique data. As I mentioned, we're cross-sectional. We target about 5,000 individuals to be examined annually. Over the years, we've oversampled many different sociodemographic groups, and we release our data in 2-year cycles. The reason we do that is so that 5,000 isn't very many people, and to get enough to make really stable estimates, we need 2 years of data. How do we do this? We're a multi-stage probability sampling design, which means we start by sampling what were traditionally counties, more on that later. And then within the counties, we sampled parts of the county or segments, and then within those households, and within that you sample people. And by the magic of statistics, you can weight it all back up to get a nationally representative estimate. What do we collect? Well, most importantly, dietary intake. We're the only nationally representative source of dietary intake. That's really important to remember. We also get dietary supplements and anthropometry, so height, weight, BMI, that kind of thing. We're directly measuring that. Prescription meds, many other things, but importantly, biospecimens, so nutritional biomarkers, environmental exposure is also really important, and then a variety of other things. And what are the data used for? So they're used for really countless things. I find out about a new one basically every day. But important to us, I would say food fortification guidelines, nutrition labeling rules, infant formula composition, the dietary guidelines for American Scientific Report, and dietary reference intakes. An important thing to remember is that NHANES changes over time. We've been around for 60 years, but we change over time as the research needs advance. And we do this by collaborating with NIH and FDA and USDA and other parts of CDC, so they can tell us what are really the important public health needs, and then we can try to support those, including FDA's nutrition regulatory research. I mentioned that we collaborate with a lot of people. These are all of our collaborators. You can see FDA and NIH feature prominently among these, and these are incredibly important to us, not only for their financial contribution, which allows this whole thing to run, but really also because they have content knowledge that we do not have. So we need them to tell us, what is it that we really should be collecting and what's the best way to get those data. So thank you to all of you collaborators. Some examples of how NHANES is used for FDA work. So your food labels, how do we know what a serving size is? We know that from NHANES data. We inform the Closer to Zero initiative to try to reduce lead, arsenic, cadmium, and mercury in foods consumed by infants and young children. How do we know what's consumed by infants and young children? We know because of NHANES. Some more, FDA is in the process, almost done, with revising their definition of the food labeling claim healthy, and our data has helped inform that. Recently when the FDA authorized voluntary fortification of corn massa flour with folic acid to help reduce disparities in neural tube defects, our data was critical to that as well. Where are we now as a survey? We left the field in March 2020 due to the pandemic. And we managed to get back in the field in August 21 to August 23, completing a 2-year data cycle. And we managed to just recently release those data, or not quite all of those data, but most of those data in September and October. October was the dietary data release on Halloween, actually. Here's some of some of the important data that's come out of this last cycle. A lot of our heavy hitter items, as I call them, obesity, diabetes, hypertension, lipids, and most recently anemia. Check these out; they're well worth reading. So, as I mentioned, we came out in August of 23. So what are we doing now? We're trying to get back in the field as fast as possible. We're under a brand new 10-year contract with a new contractor. It's RTI, which means we have to build the whole thing up from essentially scratch. We plan to start collecting January 31st will be our kickoff date. We're going to still be collecting 5,000 people per year, or examining 5,000 a year. And we had to take away oversampling during the pandemic for a variety of reasons, but we'll bring that back. And we have a few new tricks to try to help increase our statistical power, including increasing our number of primary sampling units and changing those primary sampling units from, I mentioned before, they were traditionally counties. They'll no longer be counties. They'll be what are called public use microdata areas, which have some better statistical efficiency to them. And we'll also be spreading out our sample by limiting to no more than 3 people per household. So spreading out the sample is better statistically, and that's what we aim to do here. I was maybe a little optimistic when I said we're on track, yay. So we're mostly on track. We got our main part of ERB approved, but we're still going back and forth with them on some issues. Our OMB package is in clearance, but it's not cleared. And our IT systems are still being finalized, but they are not final. So we're really getting there. I think we'll hit the field largely on time, but we might be a couple weeks here or there late. But we've already started our advanced arrangements and recruiting and training. So we're pretty much where we need to be. We have new trucks as well. Why do we have new trucks? Because we were given special funding to get new trucks because our old ones were really old. And the trucks are better than the trailers in some ways in that they allow us to move within a PSU if we need to. If a PSU is really big, we can be in more than one place. And that gets you closer to the participants and hopefully helps increase your response rate. That's the first time we got to look at the truck. You can see how happy I am there. It's actually 3 trucks that makes a mobile examination center. What's the 25-26 cycle going to look like? So what we decided to focus on is largely to try to collect data that's really similar to what's in the past, what we've done in the past. So we have new post-COVID baselines. So on the left, you see sort of our core stuff, dietary intake, blood pressure, supplements, et cetera. On the right, you see things which have sort of cycled in and out, but we'll be getting them, this time around because we think they're important. Of course, dietary intake will continue our longstanding partnership with USDA under What We Eat in America, and also dietary supplements in our partnership with the NIH's Office of Dietary Supplements. We'll be continuing our flexible consumer behavior survey, the FCBS, which collects economic measures like food expenditures, as well as behavioral indicators like, what foods are available in your home, and do you use the food labels when you shop, and things like that. It was hard to fund this time, but we worked with OBSSR, ODS, and others to get that funded. So we're excited to continue that. We always have new labs every cycle. There's always going to be something new. Aldosterone, IG, depends what you're really interested in, but there's some really exciting stuff here. What's coming beyond that? In 2027, we hope to expand blood draws to infants. We always start at 12 months, and this will be 0 to 11 months. And that's going to allow us to have improved reference ranges and also the first nationally representative blood biomarker data from infants. Other things like microbiome we'd love to get. We weren't able to get it this time. However, we're doing this on a really limited budget. As of now, more than 60% of our funding comes from our collaborators, not from our internal budget. And our collaborators are stretched really thin as well. And some things we just couldn't get in the survey this time around that we thought would be important. Fundamentally, the future is a little unclear for us. It's not clear how long we'll be able to continue the survey. Costs keep increasing. Our internal budget has not increased in a very, very, very long time. But with that, I'm just going to finish up by the sort of where do we need to go, where I think the science needs to go. I think we need better ways to get at dietary intake, to sort of measure it, and dietary supplements as well. I think a longitudinal component so we can understand exposure outcomes relationships would be great. And then, better ways to allow people to analyze the data. And I'll also just say, it would be better if we could improve the continuity of our nutritional biomarkers rather than cycling in and out, and maybe expand the nutritional biomarkers that we capture. I'm not an expert on nutritional biomarkers, but it didn't take me very long to look in the literature and see, hey, there are lots and lots of nutritional biomarkers out there that we could be thinking about, and we need your help to sort of think about what should we really be collecting out of all of these, and where does the science need to go? We need to increase our sample size to be bigger so we can get at smaller demographic groups, smaller geographic groups. And we also probably need to increase the speed of our data release by increasing our ability to make estimates for 1 year rather than 2 years. That would be great, but we'd have to be bigger to do it, and be faster in terms of data processing as well. All these things require investment, but I think they're really critical to the science at this point. I think that is it for me.
Hi, great to be here today to share with you the resources the University of Minnesota Nutrition Coordinating Center has to support regulatory science. I'm Lisa Harnack, the director of NCC and also a professor and division head in epidemiology and community health. So let's get rolling here. I will start with just telling you a little bit about NCC. We have been around for 50 years now. It's our 50th anniversary. We support nutrition research and health promotion by providing state-of-the-art software and databases for nutrition assessment. The resources we have include the NCC Food and Nutrient Database, our Dietary Analysis Software Program, NDSR, and research support services. And what I'll do is walk through these resources and show use cases where they've been used for regulatory science purposes. Starting with the NCC database. This database includes over 19,000 foods, including products from leading brands and restaurants. We also include foods from a wide variety of eating traditions. The foods in the database have values for 178 nutrients, nutrient ratios, and other food components with virtually no missing values. And I know you can't read this, but this is 178, and I'm just going to walk you through and say that for nutrients for which there is a dietary reference intake, we have nearly all of those nutrients. So energy, macronutrients, vitamins, minerals, added sugars, and fiber. Additionally, we have individual mono and disaccharides. I forgot to highlight this, but fatty acids, individual amino acids, isoflavones, sugar alcohols such as sorbitol and mannitol, a variety of non-nutritive sweeteners, and then other things such as oxalic acid and phytic acid. Now, that's sort of what sets our database apart from other databases. Many of the food and nutrient databases out there commercially available are label-based, meaning that they're drawing the nutrition information off the product nutrition facts panel. And so it's great because they can have hundreds of thousands of foods in those databases, but you're really only going to get complete data for 15 nutrients that are required on the nutrition facts panel. And for nutrients beyond that, the values are highly incomplete or not available at all. So that's sort of the unique thing about the NCC database is that's the number of nutrients and other food components and the completeness of the data. So I'm going to show a couple of use cases of the data to inform nutrition policy. And we just recently published a paper assessing the nutrient content of plant-based milk alternative products available in the US marketplace. This analysis included 219 products from 21 leading brands. We had just updated this product category, so we thought, well, let's take a look at what they look like nutritionally. And we did this specifically because we knew that it could be useful for food policy purposes. For example, the FDA is currently considering how these products may be labeled. Can they call themselves milks, or should they use another term like drinks? So we're hoping that this paper will be useful for their purposes. We did get a lot of media coverage of this, so we're reaching consumers through the media to educate them on the nutritional quality of these products. And the Washington Post did a really fun interactive article on this where the two types of dairy milk and the plant-based alternatives were in a little game to sort of illustrate the ways that they're similar or different nutritionally. Another example is we looked at the nutrient content of plant-based ground beef alternative products available in the U.S. marketplace, again with an eye towards this being useful to for food policy purposes and for consumers as well. And so we're hoping that FDA will find this useful as they're considering labeling of plant-based alternative products as alternatives to animal meats. With our articles that we publish, we really closely track how they're used, how they're cited to see, are we hitting the mark? Are we doing things that are actually relevant? And so, for example, for this plant-based meat alternative product paper, it's been cited 68 times, including in 2 policy documents, one in the UK and one in Spain. So we're pleased, feeling like we're on the right track with that paper anyway, and being policy relevant. And a final use case is we had a student analyze margarines when we updated them in the database in 2020 to see what their fatty acid profile looked like post the FDA mandatory removal of partially hydrogenated oils from the food supply. And we found that success, the trans fats were gone from products in the marketplace, so there's good compliance. And furthermore, we found that the way in which the products were reformulated, they were still lower in saturated fat than butter. And we've seen this used in policy, actually in Iowa at the state level. There was a state representative, Jeff Shipley, who proposed banning margarine from school meals and having it replaced by butter. And Emily Piper, representing the Iowa Association of School Boards, cited our study as evidence that margarine is lower in trans fat and saturated fat compared to butter. So the bill did not pass, and I like to think that our paper had, was useful in this regard. And we also really learned that people don't know that trans fats are no longer in margarine. The success story of the removal of partially hydrogenated oils from the U.S. food supply is not known by the public very well, and also not even by health professionals. We found that dietitians were really learning from this as well. So finally, we have the software that is designed for collection, interviewer-administered 24-hour dietary recalls, typically collected over the telephone. It can also be used for entry and analysis of food records. It has a menu planner feature that can be used for planning feeding study menus to meet nutrient targets. And finally, it has a nutrient calculation a component for calculating the nutrient content of recipes. A use case of this for regulatory science is that the CDC funded a study to identify the sources of sodium in the American diet. And so NDSR and our service center helped with this study. And we found that amongst US adults in 3 geographic regions, 71% of their sodium intake was coming from salt and sodium-containing compounds added during commercial processing. So this is useful to CDC in identifying ways to lower sodium in the American diet, and useful to the FDA as it considers how to regulate salt and sodium-containing compounds in the food supply. We've actually started working with some other countries who are testing sodium reduction initiatives, so for example, Nigeria, to help them in evaluating their initiatives by looking at sources of sodium in other groups. So opportunities. So the NCC database can be used to examine food product categories under regulatory discussion, as you've seen. And we can carry out those analyses, or we can license the data to you so you can carry out the analyses. A key challenge is there is lack of funding, a funding mechanism within NIH to fund this kind of analysis. So those papers I presented have been done without grant funding. We just sort of squeezed them in. It took a while to do them. We kind of got students who were looking for research opportunities involved, but with funding, we could be doing this much more rapidly and better and for more food product categories that are of regulatory interest. Another opportunity is to actually extend the nutrients available in NHANES beyond the 65 that are included in the database used for that survey. The work involved in creating this linkage so that, all of the 178 nutrient ratios and other food components in our database could be available to NHANES. There is work in getting those linkages established and then updating them over time. But it could really expand the value of NHANES for nutrition regulatory science. And so I'm actually going to wrap it up there. And I want to acknowledge the great NCC team. We're a small group, but we're small but mighty to little with our database and our software. And I just want to acknowledge the great work that they do that make this work that I talked about possible. And thank you for your attention.
All right. Hello, everyone. I'm glad to be here as a part of USDA at this NIH FDA workshop. So thank you so much for the opportunity. I'm going to be talking, as I always do, about Food Data Central, but I wanted to highlight two specific projects that we're working on that really shows our dedication to evolving how we're collecting data and how we're sharing that data out. And I'd be remiss if I don't remind everyone every time I talk about Food Data Central that there are 5 distinct data types. This is all publicly accessible. I'm not going to be giving you a dive into these today, but we have worked a lot over the last year on communicating what these data types are. So if you go to our website, you'll see descriptions, and we now have a quick overview video series that describes these a little more in detail. But standard reference legacy is the historic analytical data set collected by USDA. Foundation Foods, which is our newest approach for collecting analytical data and providing that forward. The Food and Nutrient Database for Dietary Studies I want to highlight here because we've seen a presentation on NHANES. This is an application database for the What We Eat in America portion of NHANES. And FNDDS specifically uses for developing its 65 key nutrients, the standard reference legacy and the Foundation Food database to make that nutrition data available. We also have a branded foods database, which I'm not going to be talking about today, but I want to highlight that I did speak at the IFENS Innovation Showcase last week, where I talk about some of the changes and some of the exciting things we have on data quality that were actually driven by the need of better sodium monitoring. And our experimental foods database that we continue to evolve as Food Data Central evolves moving forward. So piggybacking off of one of yesterday's talks about incorporating nutrient science into risk analysis, I first want to talk about some of our data collection efforts and highlight this collaboration that we've started with FDA. Specifically the Closer to Zero group, as you've heard about both yesterday and earlier today. And that's to really, from the USDA and the FDA perspective, look at nutrient and contaminant food composition, both the sampling and the analysis strategy for both USDA and FDA moving forward, so that we can harness our agencies' respective strengths and unique sampling and analysis capabilities. What we would like to do is to take samples and analyze them for both nutrient and contaminant analysis so that we can match these data and have a better understanding of the nutrient variability of these foods and provide that information forward that ultimately evolves our data needs and minimizes potential duplication of effort. And so what we think is this will really spark future research opportunities. We're talking about studying nutrients and contaminations, how they correlate together, the mechanisms in which they interact. We're talking about expanding the monitoring of the changes in food composition in the food supply, taking FDA's responsibility of evaluating contaminants in the food supply and the USDA's responsibility of evaluating nutrients in the food supply, and incorporating, which hasn't been included historically, the variability of these components in these foods. The ability to study the co-exposures from foods and dietary patterns, as was talked about a little bit yesterday, in understanding these components in foods, especially as we continue to do feeding studies and have a better understanding of the actual impact on humans, and hopefully with the ultimate goal of clarifying health effects and being able to communicate these effectively for child development and the prevention of chronic disease. The other thing I want to talk about today moving forward is data sharing. And first, I want to highlight that Food Data Central follows what are called the FAIR principles. FAIR is findable, accessible, interoperable, and reusable. And so in the context of Food Data Central, findable makes sense. We have a search interface. We identify every record in our database to use. It's accessible. We have had over a 200% growth in the use of Food Data Central over the past 2 years. We see about 250,000 users every month. And 50% of that's coming from outside of the United States to get access to our data. And so making sure we continue to be open and free and making that data accessible, of course, is very important. Interoperable and reusable. This is when it comes to the research community and the challenges the research community has around data uses. Interoperability and reusability is very important. We want our data sovereignty so that when we publish research, we can understand the underlying data that was used. We want to make sure that when those who are researching food composition and making that data available, that data is interoperable with other databases and data types. So I specifically want to highlight what we're working on, which is creating a standardized data template specifically for food composition. The reason I'm highlighting this today is we've heard our previous speakers talk about the challenges of cleaning data. We've heard on NHANES the need to more rapidly be able to assess the data and move it forward. And we will be hearing in the next talk about the advances in technology. But the underlying data needs to be in a place that it is usable. And so in creating a data standard, we have called it the Minimum Information Checklist for Food Composition, or MIFC. There's a joke in the data sphere, which is there's 26 data standards. There's too much, it's too difficult to use, and so we got a group of scientists together to talk about it. They came up with a new idea, and that was to invent a 27th data standard. That's not our goal here. What we're actually doing is looking at how standardization has accelerated other scientific domains and piggybacking off of that hard work that's been created in other domains. I'll highlight specifically genomics data. There is a standard MIX-S that's used for genomics data. And when researchers are submitting this data to journals, they can require that this standard is used in order to provide a standard way of providing these genomics data forward. And what we would like is to have a minimum information standard that works for food composition data moving forward. You can imagine, as researchers and the complexity of data, the difficulty that it is when we use the same words but have different meanings. Right? When we describe a food, is the way that you described it and the way I described it, are we talking about the same thing? And a data standard is there to try and annotate the data in such a way that we understand what we were talking about. I could say total dietary fiber, but without understanding more what I mean by that, what do I actually mean? And so the data standard is meant to solve some of these challenges so that researchers don't have to go into publications, understand methods, and actually understand what the data means. Instead, there's a format to make the data not only readable more by human, but also readable by machine. And ultimately, this increases the transparency and the readability of data. It increases the sovereignty of understanding where the data are coming from, and ultimately, hopefully, evolve nutrition science and the use of this data in such a way that it makes it more sort of strengthened in our research and more enforceable. Now, in creating this, the key here is user adoption and feedback are critical to success. And so this isn't us creating a standard and forcing everyone to use it. This is going to be a process. We have a standard that works for USDA, but is this standard going to work for other agencies? Is this going to work in the academic environment? And so really taking these and using and collaborating on the standard is going to be very important moving forward so that it serves not only those who are collecting data, but those that are using data as well. And that's going to be incredibly critical to success. I'll highlight specifically within the last couple of months, there was a publication in the Journal of Food Composition and Analysis that included FAO that said in their conclusion It is important moving forward in nutrition science that we work on data standardization. So with that, as I talk about collaborations, I want to first highlight and thank the Closer to Zero team, thank Kai Blumberg, our ORISE postdoc, who is working on this minimum information checklist. And of course, let you know, please get in touch. We have our contact form on Food Data Central, and I hope to hear from you soon. Thanks.
Thank you so much to Steve for kicking us off and for the speakers, both for staying on time and for their informative presentations. Now I'm going to save the applause for the speakers until the end of the question and answers because the chat has been blowing up with all sorts of questions. So I am going to turn to Jill and let her start with one question per speaker, and then we'll open it up to the floor. Meanwhile, folks listening online, please continue to fill the chat. And then I will give a nod to when you can come up to the mic and do a question in the room. Do remember to introduce yourself and provide your affiliation. And with that, I will turn to Jill.
Great. Well, thanks for all the questions online and thanks to the speakers. Shuin, I have a question from the community online asking if the U.S. were to use 20% daily value for high-in designation on front of package labeling, why would there need to be stipulation for the front of package labeling thresholds to become stricter? It seems infeasible to promote even lower thresholds when less than 20% DV is promoted and considered healthy in U.S. nutrition guidelines and recommendations.
I think the idea is that you want to keep improving what's in the food supply. So, I mean, I think, with the 20% as a starting point, I think that's fine, but there's possibility to actually keep improving that as well. So why not try? I mean, I think it's useful to look at the data and see how companies are reformulating over time and use the data also for target setting. I talked about how it has been done in the New York City example. So I don't know what the other numbers might look like, obviously lower than 20%, but it could be a gradual process, right? And maybe gets towards 15 at some point.
Thank you. Alan, there was a question about, for you now, using NHANES data for estimating dietary intake and exposure in infants and children, including teenagers, is often hampered by limited statistical power based on a low number of data points. Because of the Closer to Zero current focus on infants and children, is NHANES looking to expand sampling in these subpopulations?
Yeah, to the extent that we can, right? Like we're limited, we're limited by our resources, but a couple things. One, we will be oversampling children again in 25, 26, so that should help some. The other thing that we're thinking about for the future is how do you get an oversample of the youngest kids from birth to 24 months? And working with Kelly, who's in the back of the room over there, and our statistical team to try to understand, how one can do that efficiently. The problem is that you can't do what we traditionally do to oversample. You can't go door to door to door to door until you find birth to 24-month olds, because you'd have to go to so many doors till you get them that it would be just way too expensive. But we're thinking that there might be some sort of newer, more innovative techniques that we can use to get at that population, and we are looking into that. But I totally appreciate the problem that the questioner has. It's a challenge for everybody.
Thank you. Now I have some questions that I'm going to combine a few about the NCC databases. So how is the Minnesota Food Database obtaining that full range of nutrients? Are those items tested on site? And what's the source of data for the NCC databases? And how is the data collected or measured for brands that aren't including that full range of 178 data points, for example, like zinc or B vitamins?
Right. So we use a food calculation program that we developed internally called FoodCalc. And what we do for packaged foods is we gather the ingredient statement and the nutrition facts panel. And from those two pieces of information, we can create a formulation for that food product. We know the ingredients are in descending order of content. We know some nutrient information about the product, so we can estimate the amounts of each of those ingredients. And we have core foods on our database, those basic building block foods like flour, sugar, oils, whatnot, for which we've assembled a full nutrient profile. Using the USDA standard reference, or no, it's called something different, but the USDA data where they've chemically analyzed those foods. And then we search the literature for additional sources of nutrient composition data for those foods. So we are estimating the nutrient content of packaged foods for things beyond the label. And so we really are relying on the label being accurate with its ingredients and its nutrition facts panel information.
Great, thank you. And Kyle, can you provide more information about sodium-related updates to the Branded Foods database, as you alluded to at the beginning of your talk?
Sure. So we've been working with IFINS and their member companies to actually validate some of the data model changes we want to make. And data validation changes so that we can present in Food Data Central actual per serving and per container information, dual column information as it's provided on the label, rather than the sort of historic conversion to 100 gram. So this should really help not understand the per serving information, but the per container information in packages when doing sodium monitoring.
Thank you. I'm going to turn to a question in the room.
Mary Story, Duke University, and I have a quick question both for Lisa and for Joanne. So Lisa, I understand it's amazing, the database we have with 19,000 foods, but I understand it doesn't have any of the additives included, which would be a huge boost when looking at, ultra-processed foods. So if you could say what it would take, because you collect information, you have the label information already in all these foods. So what would it take for NCC to add that to their database? And then my question for Joanne is, it was really interesting in Chile how they have the amount of non-sugar sweeteners on the label. And so what advice would you give FDA about changing the label for non-nutritive sweeteners, which has gained so much attention lately about health effects?
Okay, so I'll start with, the initial work would be quite a bit of work to just sort of figure out how we're going to do it and set up a process for adding those ingredients, the additive ingredients. We will not be able to quantify the amounts of those added ingredients because we really have no signal to know. They're usually towards the bottom of the ingredient listing, and we couldn't estimate the amount, but we could have a flag of yes, no, it contains these additives.
So you'd have all the colorants, all the flavors.
If it's on the label, sometimes the label is vague about some things. I may see flavoring, and flavoring is pretty broad. It could be lots of different compounds that are used as flavorings.
And for your question, Mary, I think my advice to FDA would be to start requiring the amounts of each type of non-sugar sweetener or non-nutritive sweetener be listed either within the ingredient list as a starting point. And when it's time to update the nutrition facts label again, have that be incorporated as part of it too. If a product contains any non-nutritive sweetener, then the type and its amount should be declared as well. Thanks.
And I want to jump in on that. That would be great because right now we know in other countries they do require that. We estimate, we assume that they're trying to achieve a similar level of sweetness as the sweetened alternative, and that's how we estimate the amount of the sweeteners, the sweetener that's used.
You have all the sweeteners.
We do, and we
on
have
your
amounts on them, but we're estimating the amounts.
Okay, Benoit Lamarche from Canada in Quebec City. I guess a question to Alan. I don't know if it's a hard question or unfair, but when is the NAINS or if NAINS is considering using the ASA 24 as a cost-saving alternative?
That's a good question. So, we've definitely talked with Kirsten and others about it, and with our partners at USDA. Right now, it's for a variety of reasons. It's more complicated than it sounds to just switch over, in part because right now the AMPM, which we use, is feeding the FNDDS database at USDA, which we then need. And so we'd have to really work out that among many other issues to make that switch. So it's something we've certainly talked about and we'll continue to talk about, but I don't see it. It's certainly not happening in 25, 26. If that's your question, we'll continue to talk about it for the future.
Am I allowed to have a second question? Yes. I'm just curious if anyone is thinking about incorporating environmental related variables into the database. We talk about all nutrients, but this may become a something that may be regulated anytime soon. So CO2 emissions, water use, land use.
Yeah, I can speak to that a little bit, I guess. So with regards to the sustainability and environmental stuff, there are a few things we could look at within just what's on the packaging. So you have the environmental or sustainability claims that the companies make on their packaging as a form of marketing. So we can try to capture some of those things, right? Obviously, it's not going to be complete because some companies use it as a form of marketing, others do not. And then we can also look at what packaging it is, what materials are used in the packaging, right? And you can tell from, if it's PET or some other form of plastics. And a lot of this data is actually already being captured in the commercial databases. So we can also start looking historically as well, because some of the data goes back a little bit, to be able to look at how packaging has changed. I didn't have a chance to speak, so I'm really glad you asked about this question on that slide, where I think it's important to consider that there's leaching of the plastics into our food that we're ingesting and eating. So our exposure to all these microplastics is also becoming an issue that we don't fully understand either. So I think being able to also start using that information to at least understand in our packaged food sector, what types of exposure we are also having to these microplastics. And these are also contaminating our environment, right? The waterways, soil, and then through that, again, impacting our food supply. So these are all factors that I agree we need to be paying more attention to. The larger question about greenhouse gas emissions, water degradation, soil degradation, I think it's much harder to measure well. And there are environmental scientists who are trying to do that kind of work, but it really does vary depending on where the origin of the different ingredients are from, because the environmental impacts will also be very different. And of course, you have all the transportation factors as well. Yeah.
We have discussed this, adding a food footprint for carbon, land use, and water use. There is this issue of the life cycle analyses that, is the data sufficient to know the values for the wide variety of foods that are in our database? And then there's, new partners we need to, connect with to help us develop procedures, and then funding, of course.
I'll say from the USDA perspective, we are specifically Food Data Central falls under the Agricultural Research Service, right? And Food Data Central has been moved into a laboratory called the Food for Health of People and the Environment Laboratory. And so through the reality is about branded foods is a lot of it drills down at the commodity level. So having this research available at a commodity level so that it can drive higher up research and understanding of environmental impact. I'll also note too, with this upgrade to NHANES as we evolve NHANES forward and the FNDDS, there's work in considering how FNDDS can evolve, and USDA has actively been working with the NHANES group on how FNDDS can evolve moving forward to meet the needs.
Sorry, I'll make sure to keep this quick. Maya Vadivelu, University of Rhode Island. Thank you for a great set of talks. My question is mostly for Shu Wen, and I was just wondering if you had any thoughts about, for the Kantar and Nielsen data, what would be the estimated cost, for both the data and for the labor to process it and kind of update it as new products come in, to have continuous surveillance and monitoring of the food supply so that we can be in real time looking at the impact of these different types of policies on changes in the food supply?
Oh, that's a difficult question. There have been discussions about how the government could be in talks with, some of these commercial databases to come up with agreements with, third-party use with researchers and universities, for example. And there have been some initiatives, like the ERS of the USDA has done some of this work. So this has been done, and it's basically boils down to negotiations. And includes things like for how long, the contract is for, because obviously the companies, if they know it's going to be a sure deal for 10 years, they're going to charge less per year, right? It is true that these commercial databases are going to be a bit faster than, let's say, NHANES, just because they're collecting the data on a continual basis and processing it on a continual basis. So usually you can get the previous years, if you got them in on a yearly basis, you can get the previous year's data in the spring, like by March or so of the following year. So there is a much faster turnaround. What was your other question? So the cost. On the personnel and the staffing time, it just really also depends on if you have the systems built in, right? And we're continuing to try to improve the methods as well. I talked about, our interest in trying to figure out if we can use AI along with humans, trained, skilled humans, to work together to streamline the process. I think that could potentially save some costs, but I think we need to also be working closely with, computer scientists to figure out how we can do the validation and the training to ensure that the algorithms are appropriate. And it could vary a lot depending on the country, language, the food category that you're talking about. And so I think, these are some of the things that we're just learning and trying to build in. There are going to be some high upfront costs, I think, to get those systems set up and verify that they're working well. And we have to get funding to do validation. And so I think I can't give you an exact dollar figure, but we definitely are going to need funding to be able to do that kind of work. Thank you.
Just real quick too, on the branded foods database, it's voluntary data submission, but data are being submitted directly by manufacturers. We know the data exists. We know manufacturers potentially want to supply this data and have some control over showing that they're reformulating. And so advocating for submission of data and making it available, Branded Foods updates monthly. So we could at least track monthly updates. But there are a lot of difficulties even then providing this data in a way that you can monitor.
I just want to add in quickly also, another way to get, at least on the nutrition information side of things, is web scraping. So that's another approach that has been done in several countries, including in the US, where a lot of this information is actually already out on the web. And so you can do some web scraping. I think the challenge with that is to identify what does that data represent? What time period does that data represent? Is it, and using it accordingly and date stamping it. Yeah.
Add in with the web scraping, which we've been investigating for improving our efficiency, is that the companies are blocking the scraping, so that it's kind of actually a challenge to do the scraping.
Thank you so much, the panel, for this fabulous discussion. I wish we could continue, but we have surpassed our time. So join me in thanking our panelists.
Welcome back to our next session, On the Horizon, Technologic Innovation and Other Research Opportunities to Inform Nutrition Regulatory Science. My name is Halina Castro. I'm a senior nutrition scientist in the NIH's Office of Nutrition Research, and I'll be moderating this session. I know what's coming, so I'm going to keep this really short because I'm so excited for you to hear all these excellent talks. First, we're going to hear from Maggie Zhu of Purdue University about dietary assessment in the age of artificial intelligence. Then we'll hear from Erica Loffield from NIH's National Cancer Institute about metabolomic profiling, and she has some really cool data to share. Next will be Benoit Lamarche from Laval University, and he'll talk about challenges and opportunities of using AI in nutrition research. And finally, we'll conclude with Sai Das from Tufts University, where she'll explain research opportunities on the horizon. So let's jump right into it without further ado, and please welcome up Maggie Zhu.
Thank you. Hi, everyone. So I'm Maggie Zhu from Purdue University, and very happy to be here. I may be the only engineer in the room. Any other engineers? Okay, all right. So today I wanted to kind of just talk a little bit about some of the advancement from the technology aspect related to dietary assessment. All right, so particularly I want to focus on a group of kind of technologies that leveraging images to kind of bring into dietary assessment. So what are some of the values or additional values that images may bring for assessing dietary intakes? So of course, we wanted to get the energies, the nutrients, and all that. And then from that, looking at food groups, even dietary patterns, but other things such as, the context of eating, right? So that is also one aspect that is very, important, sort of looking at over time in terms of, what are the patternings respect temporally that, we could get from images. And also, with images, oftentimes from the devices, we can get location information, where people are eating and so on. And then we see a lot of, high consent from our participant to willing to provide such information. And this is only when, they're eating and so on. And we get very precise timestamps that shows, the date as well as, the time of when people are consuming the food and then over how long of a time period this is happening and so on. So that also provides other rich contextual informations surrounded by the whole, eating event. And in some studies, we've also introduced EMAs, right? So that I think is important for looking at just-in-time intervention studies and then, different purposes along the way. So specifically, I want to talk a little bit about the mobile food record, which is active capture. By active capture, I mean that this is something that is from the phone, a phone-based app that people can use from their own devices. Now, there's other type of capturing devices such as wearables, people can wear that are passively capturing when eating events happens. So with this mobile food record, we have participants who would install the app on their phones and then use that to capture images when that eating event occurred. And then the images along with other type of contextual informations are being sent to our server for processing to analyze from the imagery data, what people are eating and so on. And so as you can see here, some examples of a before eating and after eating, and then we captured times and the locations and that rich informations. So some preliminary information are feedback to the participant on the app as well, such as, the type of foods they're eating. So we have, a set of list of foods that currently mostly associated with the FNDDS database. And of course, depending on the type of studies that we enroll, we also work with other type of data as well. And then we have in the back end, a comprehensive platform available for the researchers to look at, the records, to look at other processed data to generate the nutrition reports. So our app has been deployed in a variety of different dietary studies, in total around 30, involving over 5,000 more participants so far, and then a lot of ongoing studies are also using the app as well. So you can see here, we have variety ages as young as 3 to 12 months. Okay, we've done this looking at food waste type of studies. We also have international collaborators in Australia. So these two studies are from Australia, where we're looking at, for example, accuracy, acceptabilities, cost efficiencies, effectiveness across different technology-enabled methods. And more recently, so this is one that just came out this year, that we're looking at comparison in terms of energies and nutrient intake estimate among 4 different methods that are used in Australia. So a variety of things are going on with deployment and then kind of really test new technologies in different type of dietary studies. And I wanted to just highlight ongoing study for the Nutrition for Precision Health. So as you can see that we have both the kind of the well-tested methods such as the DHQs, the ASA24s that are being deployed, as well as newer technology-driven methods such as the mobile food record, as well as the AIM wearable devices. So what we can see is that with large cohort type of studies, these different technologies or different dietary assessment methods can give us a variety of different coverage in terms of some methods may be really good for looking at one outcomes or one specific aspect, while others, the newer technologies, is really a good platform for us to really test at a larger scale type of study. So I wanted to speak a little bit kind of behind the scene of what happens with these technology-driven methods, particularly with image-based. So our data collection starts with capturing images or strings of images, and the backend analysis try to understand what is in this picture. Right, so in terms of where the food is, which pixel represent what food, and what type of food it is. And you'll see that we also have this checkable here. So this provides one method of physical reference to know the portion size. So based on a known reference object, we can then estimate what is the volume or the portion size of the food. And then along with the type of foods and retrieving the information from the databases, then we can calculate the energies, micronutrients to generate these results. So at a very high level. So I wanted to bring out some of the challenges. Okay, so now this is, again, with any technologies, there's always challenges. So one of this is the complexity of the food itself, right? So we all know food is very challenging. So I show an example of where we have mixed dishes, and then they may have different cuisines, but yet the appearance alone may be quite similar. Okay, so this is obviously, a challenge. And there's also challenges associated with how the data is being captured under, real world lighting conditions, background clutters, occlusions, and all of that. And so this could affect the quality of how the data is being captured. There's also innate challenges with how we recognize the different foods, right? Some foods may appear visually very similar, but have, significantly different content. Or some may, look very different, but yet they share, similar nutrient values. And then this is, really a problem that we have a global community who's working on this. So then depending on, the regional foods, the cultural, variations, this, creates adds the complexity to the problem itself. I also wanted to, highlight, when we develop this in the lab and deploy in the real world, there's also, a set of challenges there too, right? So for example, here, if we, use a data set, which, may be from online sources, a different variety of sources to train, a machine learning model to do recognition. But when we deploy in the real world with, different type of data distributions, the outcome can be very different. Okay, so here is, sort of extreme example where, we have a training data from a fixed set of data sets that we use, and then deploy in some other study data, and you'll see a significant drops in that, right? So how do we leverage the rich data that we're collecting from, different variety of studies to help improve, the model's capability to be more accurate and to be able to adapt to the different type of distributions? So the good news is that there is a community, in the engineering, the computer science field where, we are interested in solving this problem. Okay, so and as this can be reflected, as you can see from many of these workshops, challenges that are happening all over at, these conferences and in places where, engineers, computer scientists go to. And I think it's important that we carry this message into that community so they see that there is value in solving this problem and helping, moving the field forward. So just a quick overview of some of the work that our labs are working on, focusing on doing food recognitions, portion size estimations. So some of these newer methods are looking at how do we tailoring to individuals, right? And then how do we continue to make our model learn about, new data? And then also looking at the data distribution itself. Not every food is eaten equally. Some are more frequently consumed, some are less consumed, right? So how do we make sure that our tools and algorithms are able to handle these different variety of situations and to improve, the accuracies and efficiency of that? And then also leverage 3D data sets, right? So one of the things I want to highlight is this, data set we are collecting and ongoing is that we use, 3D scanners engineers to actually collect real foods, some of which are quite challenging. But what we wanted to do is to kind of make this available to the community and say, hey, here is a somewhat complete data set with not only just imagery data from 2D, 3D, but also some nutrient facts that we have about the foods to really start, looking into how to move and pushing this field forward. So lastly, I wanted to just, highlight some ongoing works. And of course, our goal is to provide accurate, user-friendly tools to help with, assessing dietary intake. And here are some research questions we, would love, the community and then involving, people in this, room here to really move the field forward. So with that, I'll conclude my talk. Thank you.
Good morning, everybody. My name is Erica Loftfield. I'm a nutrition and cancer epidemiologist in the intramural research program at NCI. And today I'm going to be talking about metabolomic profiling of ultra-processed food in 2 different studies. And this is, I think, a paradigm of successful biomarker development. So just to get everybody on the same page, the metabolome refers to the complete set of small molecule chemicals found within a biological sample, and it reflects the interaction between an organism's genome, microbiome, and environment, including diet and lifestyle. These small molecules, or metabolites as they're commonly referred to, have both exogenous origins from food and other environmental exposures, as well as endogenous origins. The study or measurement of the metabolome is called metabolomics, and there are several technologies that can do this, but it generally refers to the measurement of relative or absolute levels of many small, low molecular weight molecules. This can range from tens to thousands, depending on the platform. And these are measured in biospecimens and a variety, but most often we're using blood and urine. I'm not going to spend any time going over the definition of ultra-processed food since we got a great overview of that yesterday. But I will just say that it's because of this widespread consumption of ultra-processed foods that we're really interested in studying this relationship in epidemiologic studies. In most prospective cohort studies, we use food frequency questionnaires, and these typically lack sufficient information on processing, source of food, ingredients, et cetera, that are needed to give accurate NOVA classifications. And so there's a lot of concern in the research community that we are inaccurately capturing ultra-processed food consumption. And at least in the context of prospective cohort studies, this would tend to underestimate the association between the exposure and disease risk. So in a series of experimental and observational studies, we used a discovery metabolomics approach to identify candidate biomarkers of diets high in ultra-processed food. And this should all look familiar to you because this is Kevin's study that he presented on yesterday. And so again, I'm not going to go over the study design, but just to say he very generously let us use some of his freezer samples to do metabolomic profiling on the trial that had the 80% and 0% ultra-processed food comparison. This analysis was led by Dr. Lauren O'Connor, who everybody here knows, and we used Metabolon's discovery platform to measure more than 1,000 plasma metabolites and more than 1,200 urine metabolites. And the EDTA plasma, as you can see up here in the study schematic, was collected at the end of each 2-week diet phase, and the urine was collected at the end of week 1 and week 2 and measured for metabolomics. To identify the metabolites that differed between the ultra-processed and the unprocessed dietary phases, we used a linear mixed model, and this was to account for the repeated measures in the crossover design. And then we applied a 5% false discovery rate correction to be able to account for the multiple comparisons that we were making. And so we found a lot. Looking at the plasma and urine results side by side, you can clearly see in blue that the xenobiotics predominated in urine. And this is unsurprising, given that urine is likely a better measure for diet and xenobiotics. But we also saw a lot in plasma. Interestingly, more than half of these metabolites, and each of the metabolites is shown as a dot, were to the left of the dotted vertical line at 0, and that indicates that these were lower after the ultra-processed food phase, and the dots to the right indicate that they were higher. But I think it's interesting to note that things that were lower after the diet phase for ultra-processed food reflect what was not being eaten. So many of these things come from things like fruits and vegetables, as I'll show in the next slide. So just zooming in a little bit closer at the 30 metabolites that differed within individual between diet phases in all of the 3 biospecimen types we looked at. And the direction of the association is indicated by the direction of the arrow, so up being a positive association and down being an inverse or negative association. And what you can see here highlighted by the arrows, we have 2 compounds that I've highlighted that are xenobiotics, cinnamyl glycine and tartarate, and these come from plant sources, from fruits and vegetables, whereas asulfame, which was positively associated with eating the ultra-processed food, likely comes from an artificial sweetener, asulfame potassium. So I think this is really interesting. In our second study, we aim to use metabolomics data and machine learning tools to identify metabolite scores that were predictive of diets high in energy from ultra-processed food in a free-living longitudinal population-based study. This is the Interactive Diet and Activity Tracking Study in AARP, or iData study. In iData, participants reported on their activity levels over the course of 12 months using a variety of self-reported, device-based, and biomarker measures. And participants were randomized to one of 2 groups to lower the impact of seasonality on the exposure measures, and also just for practical purposes. So you can see that they completed up to 6 24-hour recalls, or ASA 24s, over the course of 12 months, as indicated by the blue dots. And they also completed 2 different biospecimen collections at either baseline in 6 months or 6 and 12 months. And because of the day-to-day variability in both diet and metabolite measures, we leveraged this repeat sampling and estimated 12-month average ultra-processed food intake from ASA 24, as well as 6-month average metabolite levels. This analysis was led by a postdoc in my group, Dr. Layla Abar. And first, we estimated the correlations between mean energy intake from ultra-processed food and metabolites. Again, we saw hundreds of associations. We found that 187 serum and 284 24-hour urine metabolites were correlated with energy from ultra-processed food after FDR correction. And then to put this in the context of the domiciled feeding trial, about among the significant correlates in iData, more than 80% were reflected in the randomized control feeding data in terms of direction of effect and statistical significance. So then the next part, which I think is really exciting, is that we wanted to build a polymetabolite score that would be predictive of ultra-processed food intake in serum or urine. And to do this, we used least absolute shrinkage and selection operator, or lasso regression. We applied a 10-fold cross-validation to select the optimal lambda value. And then to ensure the robustness of our model and prevent overfitting, we divided the data set into training and testing sets. We used the training set to select the metabolites and the testing set to evaluate performance. Finally, we assessed the selection consistency of the metabolites by running the lasso 100 times on randomly selected 80% subsets of the data. And the frequency of selection for each metabolite was recorded, and that's shown in the bar plots here. And what you can see is for most of the selected metabolites, they were selected more than 60 out of the 100 times, which indicates that they're robust markers in this selection method. Skipping ahead. Okay, so if we zoom in on the individual metabolites that were selected by lasso, there were 4 metabolites that were selected across both serum and urine samples. And these included amino acids that were negatively correlated with ultra-processed food intake, and interestingly, 1 carbohydrate and 6 carboxymethyl lysine, which is highlighted here in blue. And it was positively correlated with ultra-processed food intake, and it's an advanced glycation end product, which has been associated with diabetes incidence as well as severity and risk of other age-related chronic diseases. Finally, we calculated biospecimen-specific polymetabolite scores. So that's indicated up here in the last bullet point as PM score. And what you can see is for this polymetabolite score, the correlation in the training set was 0.6 for serum and 0.64 for urine. And then it was very good also in the testing data set. And you can see how much higher those correlations are for that polymetabolite score that we built off the lasso regression model as compared to each of the individual metabolites that had correlations, closer to 0.2, 0.3. So to bring this full circle, we calculated the polymetabolite scores derived in that free living population of 700 or so people in iData with a wide range of varying diets. And then we applied those scores to the randomized control feeding trial data. And what you can see is within the 20 individuals in the randomized trial, our score developed in iData discriminated fully between the two diet phases. The p-values for the paired t-tests were highly significant, and I think this really supports the validity of these polymetabolite scores, and again, provides a really compelling paradigm for biomarker development by combining these observational data sets with these highly controlled feeding studies. So in conclusion, I think metabolomics is a very powerful tool for biomarker discovery. I've only scratched the surface of it. A lot of people are doing great work in this area. I think one unique thing about our approach is we've been combining the feeding trial and the observational data because they can really provide complementary data. In the randomized feeding trial, we showed that there was a measurable impact on the short-term metabolome, but we were concerned that it might not be generalizable when you have a variety of diets. And so, by bringing in the observational data, we were able to address that. And the reason we're doing this is because biomarkers of intake and response have the potential to improve reproducibility and provide mechanistic insight for diet disease associations, which is our ultimate goal. So in closing, I hope I've piqued your interest in the potential of metabolomics and, of course, other omics for advancing etiologic research on diet and chronic disease. Thank you.
Good morning, and thank you to the organizers. I'm pleased to be here. I believe I'm the only Canadian among the speakers, and last time I checked, Canada was still not part of the US. I'm going to be scratching on the surface as well on the topic of methods, and just before I do, how do we change that here? I guess that's this one. Yeah. Disclosures, just publicly funded research, but also I want to disclose I'm neither a nutritionist nor an AI specialist. So that may give the perception that I'm an imposter, but that's actually an advantage, I think, because I'm not defending a historical perspective on either side of this research. So we've heard about different opportunities and new methods that we can deploy and use in nutrition research, precision public health, image-based methods. I'm just going to touch upon the potential of AI and machine learning in dietary assessment. And, we are having this discussion in the room, in the corridors. It's so complicated to measure what people eat. And this is the typical diet of Canadians. And in this publication in 2016, you might have seen that, different place around the world, what people eat. It's really hard to do. And we have different methods to do that with food records, FFQs, whatever. And then you can use a priori defined indices to assess diet quality. And you have some examples there. And these are really driven by how we think we should define an appropriate diet. And then you have a posteriori database methods and such as principal component analysis, for example, where you just let the data decide for you what is the pattern and how does that relate to health. And with the advancement and application of AI and machine learning to nutrition, then we're discovering new ways to assess dietary intake, to classify patterns and to relate those patterns to outcomes. So I'll give you one example of an approach, and again, just scratching at the surface. So you can use the totality of the data you collect with a food record, for example, and just correlate every food and the amount of every food that's reported in records, and then use a machine learning algorithm to create a network of patterns that essentially identify groups of foods that are consumed together, most often that correlate together. And it's a little bit like using an influencer, a social media approach where you have foods that are influencing other foods more than other specific foods. So influencing in terms of correlation. So that is very interesting because then you can get at specific patterns of consumption that were revealed using these new machine learning approaches. And this is an example of that data in pregnant women. And they use data from 24-hour recalls. And this is the foods reported at lunch only. And they have looked at the network, the patterns of consumption among two groups. So the women that had a lower diet quality based on the HEI 2015, high diet quality. And just looking at the colors, it's obvious that the patterns are different. And the relationships between specific foods are different also, just at lunch. And why is this interesting? Because that if you believe that this is real, and I think based on correlation, these are real data, then from a public health perspective, you could decide, well, we're going to try to look at specific foods that seem to influence the intake of other foods, quote unquote influence, and perhaps these become interesting targets for intervention. Now, I tend to be an optimist person, but also a pessimist and a realistic person. What we're left with all of these new methods to characterize dietary pattern is a whole bunch of new methods that are being applied. And what we're going to have problems with in the near future is integrating all of these new methods in terms of what their output is. So if everybody is using a different method to characterize dietary pattern, how are we going to come up with some form of integration in meta-analyses, for example? So this is something that's really puzzling and challenging, and we have to think about this as we see more and more research being undertaken in this area. Predicting outcomes, it could be health outcomes, it can be nutrition outcomes, and this is something I'm interested in. And so we actually, so the colors don't show, but it's not really important. So what we did is we used a sample in Quebec, and we used different machine learning algorithms to predict who's consuming enough vegetables and fruits. So the bottom two models are traditional methods like logistic regression, for example, or lasso regression. And then all the other ones are machine learning models. So there are two things on this slide. All models perform similarly in predicting adequate vegetable and fruit consumption, similarly and poorly. So we're predicting just with an accuracy of 60%, and that's the best we can do, but the machine learning are not doing better, and all models are doing the same. So that's the first observation. So we need to, and so when we work, and I'll talk a little bit about this, but when we work with machine learning experts, they tell you what they tell us, because we have such a poor accuracy, is that something is wrong with your data because our models usually are perfect. Well, we can talk about this, but this is the data we're having and we're dealing with. So that's the reality. Now, what's interesting is if you look at the variables, so we're using about 600 variables in those models, behavior variables, BMI, all kinds of variables that are related to diet intake. So each model is on the x-axis, and each color represents the first variable in the model, the second variable in the model, the third variable in the model. And if you look at the different models, they don't have the same colors. They don't have the same variable predicting poor fruit and vegetable consumption. That's a major problem, because from a public health perspective, if you try to identify the influencers, the determinants or the variables influencing fruits and vegetable consumption, they're going to be model dependent. And so that's a big problem, and we have to keep that in mind, and we have to educate, and we have to be aware that this is, if we come up each with our model, which different predictors, it's not going to make any sense at the end of the day. So this is what the engineers and data scientists work with. Perfect images. That's where AI and machine learning started. We can clearly identify which one is the cat and which one is the dog when we use machine learning. This is working perfectly. This is the nutrition data. Okay. And this is our reality, and we have to work with that, and we have to be aware that we're limited by the quality of our data, and how can we fix that? We can use methods to better assess diet intake and so forth. But so machine learning is not magic; it's not magical, and of course the quality of the data is key here. So, not being just negative, there's a lot of potential and potential solutions. From my own experience, if you start working with scientists who have expertise in machine learning, you have to learn their culture and they have to learn yours. And it's been quite challenging, actually, because I was working with a world leader in this area in Quebec, and I was telling him, where's my p-value? Okay, I'm predicting accuracy. Is there a p? Is there a 95% confidence interval? He didn't care about that. It's like, well, I need this. This is my culture. And so we have to adapt our cultures, understand our vocabulary. I think we need, and there's a great opportunity for research here, is to standardize methods, or at least write some guidelines on how to use these methods and how have a common vocabulary. So at the end of the day, we can make these data work together and analyze those data in a meaningful way. So guidelines for researchers, some kind of white book on how to use machine learning in nutrition or something like that. And also building capacity. The last thing we want is for scientists, engineer scientists, to do our research in nutrition. We need to own it, and we need to form and to train the younger generation in understanding these methods, because the questions are asked from a nutrition perspective, not from a machine learning perspective. And that's it. Thank you very much.
And good morning, everyone. And thank you for the opportunity to share a research opportunity that's on the horizon. All right, so before I talk about the actual opportunity, I'd like for us to use 1 minute to briefly look at how the advancements in nutrition science have brought us forward, with starting from calorie and protein requirements back in the 1800s. We now have solved quite a lot of problems. So the nutrition science has, and the field has solved a lot of problems with identifying the role of micronutrients, nutrient deficiencies, establishing the RDAs, defining nutrient adequacy, and making sure that the population health is maintained, and establishing the DGAs and the DRIs. Of course, these two bodies require a lot of evidence, and our job is to generate rigorous and robust science. But as daunting as the conversations the last 2 days have been, I do want to say that together we can make progress. And toward that effort, I really commend the conversations of the FDA and the NIH, and I think more of that is what is needed. But one thing is that we all agree, and we're here together because we understand that suboptimal diets impact health, morbidity, and mortality, and that is something that we recognize. And if you look at all of the actual direct implications of nutrient deficiencies and nutrient suboptimal diet-related impact on morbidity and mortality, the impact is quite high. And as we recognize that, we do also know that for now we are limited in having more, broad recommendations that are not specific enough for the demands that the public has. And so we know that, myself included, we've conducted these randomized controlled trials over and over again. And these trials do show us that there's not only great inter-individual variability in response, but also there are some responders and complete non-responders. So at the, end of this, whole exercise, we as researchers always want to ensure that humans are benefited the best way we can help them. And so we have also done some science where we recognize there are multiple factors, this is known to everyone, that are responsible for some of this variability and accounting for the differences that we do observe at what we call the inter-individual variability. The issue, however, is that, there are the basic variables such as the diet, genes, and biological sex, and all of these that do contribute to our basic demographic variability, and then lifestyle factors that we do choose, and gut microbiome and health. But the limitation has always been, especially in the field of nutrition, that these factors have not been comprehensively examined in the same setting and in the context of the population that we are interested in helping. And so that is essentially the gap that, has been recognized widely, but hasn't been addressed before, at least in nutrition research. And we also know that these customized recommendations are what are going to really help move the needle with making behavioral changes. And so the opportunity was recognized by the Nutrition for Precision Health study. I'll refer to it as NPH. And what the Nutrition for Precision Health study does is it leverages the infrastructure of this national initiative, the All of Us, which we all know about, which is a study of precision medicine and precision health in over 1 million individuals. And using that infrastructure and leveraging that and using all of the computational advantages and AI and other technological advances that we do have, and the data that we now know from microbiome research, as well as dietary assessment methods that were nicely described, we have the power and the ability to get closer to what is precision science. And so what I'm going to do now is to describe the Nutrition for Precision Health in a little more detail, and then we can talk about how we can use this platform as a way to look at more synergies between interagencies, between groups that are interested in questions that will inform policy. So what the Nutrition for Precision Health's primary goal is to develop prediction algorithms to help describe some of this variability into individual response. And like I said, the comprehensive set of measures include microbiome, genomic, physiological, metabolic, behavioral, contextual, environmental, and a variety of health record as well as survey data that is all being put together. The genomic and health records come from the All of Us, and then NPH augments that data by getting some rich nutritional information as well as behavioral information related to eating and diet behaviors and lifestyle. And this also includes a more representative population, given the breadth and the scope of the population that is included in the study. So that's pretty much what the overall vision is. The NPH uses a modular approach, and by modular we mean we have 3 modules: Module 1, Module 2, and Module 3. And why, you may ask, do we have 3 modules? It is because Module 1 really serves as an observational data set that allows for us to collect a variety of information, the comprehensive data set that I described just now. And we are looking at people as they come. We're looking at baseline diet and baseline physiological responses to meal challenges. And so this rich observational data set then allows for us to make some inferences and interpretation that in the context of having all the measures in one place. And people are pretty much, opting into this from the All of Us study, because the Nutrition for Precision Health is powered by the All of Us. So that is where our source population comes from. And those who are interested and eligible to do one of the other 2 modules that are there, Module 2 and Module 3, are then brought in to participate in these 2 phases. The difference between 1 and 2 and 3 is basically that 1 is observational, as I pointed out, and 2 and 3 are control feeding studies. Now, participants can join Module 2 or 3, but not both. And the difference between Module 2 and 3 is that 1 is in the community dwelling, studied in the community dwelling condition, and the Module 3 scenario is in the live-in or control feeding studies that are conducted in the live-in situation. We do have 3 diets that are being provided to the participants in both scenarios, and these diets are consumed by all participants in a randomized order. So that is essentially the framework for how this study is conducted, and the data that is collected includes all of the comprehensive measures. Now, the diets, basically the diets are chosen to be reflective of what we eat in America, but also have compositional differences that are going to be able to help us have responses be elicited in the individual, as well as be able to be studied from the context of what's happening to their metabolism when they're exposed to such diets. And so that is the philosophy here. And as you can see from the description of the diets, some are more processed, some have lower fruits and vegetables, and others do have higher fruits and vegetables. And so that is sort of the compositional difference that we were aiming for. And again, these are not some weird diets. These are reflective of what we consume. And why 3 modules again is another sort of data question that you may ask. It is because module 1, which is the observational data set, serves as a training data set for all of the important information to be collected. And so we can look at the measures and inform the computational models and the computational processes. And so module 2 is where the intervention data is used to get the prediction responses as well as the algorithms developed. And module 3, which is the residential in-phase, the residential phase, is a module that serves to help us validate some of the different questions that are being discussed. Is it really true that the diet that we provide them, results in the measures that we are looking at, and how are some of these other methods for diet and other assessments really interesting when we know that we can account and control for most of the variables in the residential facility. So this modular approach is really what we use. And to support this science, we do have a very robust infrastructure that also includes the multiple disciplines that are needed in order to comprehensively study everything in one setting. And that is essentially what this is showing. And we have clinical centers, we have assay centers, we have the microbiome center, and then the research support centers, and everything is triaged through the biobank. And we have the machine learning and the data modeling centers as well. So you may ask, what is the point of all of this in terms of the regulatory science and information? And this is a rich opportunity for us to not only have the computational and data related power to be able to answer the questions that inform prediction algorithms, but it's also a very rich opportunity for all of the questions that we need to ask. For example, on processed foods or refined foods, what happens in the real world setting with all the observational data that we do have? How do those work? How do the methods work? And infinite questions. And so today I will not have the time to do all the use case scenarios, but I really think that we should be thinking about all of this and to help inform and advance the science. And then I just want to say that we do need to have, this has been elegantly discussed, we do need to have a way to close the gap between what is happening and then essentially advance the science in terms of research designs that are being discussed, as well as essentially consider all of the aspects that were well discussed yesterday. So I'll wrap up there and really point out to what we really always have to keep in mind, that if science needs to inform policy, it's a very integrated approach. This was elegantly discussed yesterday, but there are implications both upstream and downstream that we always need to consider. So thank you.
Thank you to all of our speakers for a really excellent session. We do have time for what unfortunately has to be a pretty brief question and answer session so we can keep on time and get you all to your travel. So if you do have a question in the room, please make your way to the mics, and the questions have been coming in online. I'm going to start with a question for any panelists or all panelists. We heard from Sai and Maggie about the Nutrition for Precision Health program, which is kind of a deep nutrition dive in 8,000 people, but it's nested in the larger All of Us research program, which has the goal of enrolling 1 million or more, and already has more than 500,000 fully enrolled and very engaged participants who are ready to discuss more research opportunities. So what opportunities would you leverage to add some sort of dietary assessment within the broader All of Us? What would it look like as far as the methods or the timing or the opportunities you would take?
I maybe start with the technology side. So I think, the exciting opportunity is that a lot of these technology has been out there, people are developing, but it's never been tested at such a large scale. And then the fact that there are, as you see in my slide, 4 different dietary assessment methods that are deployed. So that rich development to deployment, and then from, a much smaller type of scale in terms of the data that we're getting to the larger, data that we're getting, I think is what really the driven force moving that technology forward. And then the other thing I want to add is that, I'm coming from a community where it is very open because we develop algorithms and then we test our open data set. But, if you look at the data set related to image-based approaches, what's out there are not realistic data. Well, what people are eating, those are scraped from websites. Those are not, really reflecting. So how are we going to be able to really truly test the power of these algorithms without using real data? So that is really, I think, a research gap that we cannot be addressed until we have the help from this community to help moving it forward. Thank you.
And I'll just add, I think that is a key piece that is missing. And I think for now, until we have methods that are very low burden and are quick, I would go with collecting it using the traditional ASA24 type methods, because resource is also a huge factor. As you know, there are competing demands on what we can do. So having that, and then having an infrastructure within all of us to be able to get the self-reported technology-based data that people are collecting anyway would be a great way to go. So thank you.
I'll just add to that too. I think it's really important to think of dietary biomarkers as complementary to dietary assessment. And that's something that we're really championing in a new cohort at NCI to do both the validated instruments, ASA24 and DHQ3, but then also to have those biospecimens collected for that opportunity to do dietary biomarkers.
I just want to add that the timing, I think, would be annual, to answer your question completely, because there are so many trends that are changing that, it would be a missed opportunity if we don't do it annually.
Thank you. We'll take a couple in the room.
Yes, Rafael Perez Escamilla from the Yale School of Public Health. Erica, can you speak to the cost of the analysis of the ultra-processed food biomarkers that you have so elegantly discovered with your team?
Yeah, and I mean, that goes to the point of these being complementary data as well. I mean, ASA24 and DHQ3 are freely available tools, whereas a single assay for a metabolomics platform ranges from, $100 to $300. And so we do these nested studies for efficiency, but, it's going to be a long time before we can profile 500,000 people using metabolomics. So I think the cost of the iData study, for example, which I'll say is, publicly available data, people can apply to use that metabolomics data and study different dietary exposures. But, it was almost $1 million.
Yeah, I also have a question for you, Erica. This is Shuan Ng from UNC. I'm curious about, I presented about what's in the branded database, I guess, like in products, and that with some of the policies that are occurring, we're seeing reformulations. And so there are going to be always new ingredients and additives added to our food supply. That should affect the metabolomics and what pops up, right? That's more significant. So I'm curious about what does that mean in terms of keeping up to date, given that we know our food supply is constantly changing. The turnover in terms of the products, in our food supply is about, I've heard some estimates as 80%. So yeah, what are your thoughts related to this?
Yeah, a couple thoughts. I mean, I think it certainly affects the metabolomics, but in general, our dietary assessments aren't necessarily always keeping up with current time, right? So, but at least from the metabolomics perspective, I think this is one of the places where the potential of these polymetabolite scores really shine, because we're not trying to use a single metabolite to characterize a very complex exposure. We're using, a set of metabolites and weighting them according to the magnitude of their association. So it's going to change population to population. It's probably going to change over time as things reformulate. So this is going to be a continuous process. We need continuous nutrition funding, not just at one point in time.
I'm going to turn it to Jill for online questions.
This question came in to Benoit during your talk, but others on the panel could also respond as well. What efforts have there been in expanding our knowledge of the additional factors that determine what we eat? At the food group level, we know commonly correlated foods. However, not so much is known on how environmental factors may influence our choice of foods. For example, moods, foods consumed earlier in the day, stress, and so on. So could that remaining 40% in the prediction lay there?
Yeah, so it's a great point, and we did include a lot of the behavioral variables in our analysis. The challenge is really, and this image of a cat and a dog. It's really hard to measure if what we're measuring is accurate, and so there's noise in the data. But I think there's potential for these new technologies to because they can manage so much more data than the traditional methods. but we have to find ways to reduce the noise in the data. And that's where machine learning can help us as well, is to kind of get us with better data and therefore perform better in predicting the nutritional outcomes. But I think there is potential. We have to just be aware of the challenges. Yeah.
Okay, and sorry, the last question here, it was during Erica's talk, but again, others could respond as well. Thank you for your talk, and a lot of epidemiological studies, food frequency questionnaires are used, and one challenge is that they're not collecting information or sufficient information on dietary supplements. Or if they do, the food frequency questionnaire may be using a different set of categories of dietary supplements. And these supplements are so full of bioactive constituents. And so if the data aren't collected on the supplements, it could be challenging to know what's going on. So in terms of metabolites on biospecimens, or it'll be challenging to know what's going on in terms of metabolites and biospecimens. So asking more, is that true? And can you comment on that?
Yeah, so talking sort of about the different formulations of
dietary supplements, and do we have the data collected on those bioactive constituents in the dietary supplements, and are those reflected?
So we have done some work, and others have done some work as well on metabolomic profiling of dietary supplements. But again, one dietary supplement might not be exactly the same as another brand, or even the same as itself over time. So again, it's sort of this ongoing work, but I will say, at least for multivitamins, where more work has been done, there are a handful of metabolites that across different studies, there have been very consistent, similar associations. And so when you look at the totality of the metabolomic data, there are some promising findings, at least for multivitamins.
And I just wanted to add, it's interesting that we didn't ask to collect supplementary informations, but yet we do see a lot, but from, this MPG study, that people are, including these as part of their diet. So I think that also gives info, because we're collecting other, biomarkers and et cetera to, for later analysis and comparison. So it's encouraging.
Okay, thank you. That will conclude our second session of the day. We'll be doing a quick transition into the next session. But before that, I want to thank Jill Reedy for her online moderation. And thank you to all of our fantastic speakers of the session.
All right, good afternoon. I'm Krista Zanetti. I'm the moderator for the last session of the workshop. And I'm a program officer in the Environmental Influences of Child Health Outcomes program at the National Institutes of Health. Over the last day and a half, we have heard some interesting and provocative presentations highlighting a broad range of topics in the nutrition regulatory science space. These topics generally included research gaps, opportunities, and emerging questions, case studies, methodologies for risk analysis, impact analysis and implementation science, databases and other research resources, and technological innovation. So we covered quite a lot. So this last session is a panel discussion designed to reflect on what we heard during the workshop and put it all together. So to do this, we have enlisted 3 esteemed panelists who are here with us today. So we have Rafael Perez Escamilla from Yale School of Public Health, Shariki Kumanika from University of Pennsylvania, and Mary Story from Duke University. So I am going to ask them several questions, and we will get an opportunity to hear their thoughts about sort of what they heard throughout the workshop and what their reflections on that are. So I think the first question, you got to sit beside me, so we're going to start with you, Dr. Perez Escamilla. We're going to start with you for this one, then we'll just go down the line for this first question. What are some of your most important takeaways from the workshop?
Thank you very much. So I'll start with a couple of them. So there is no doubt that there is a need to invest more on risk-benefit analysis based on complex biological systems frameworks that take both groups of nutrients and contaminants into account. And this research needs to also be accompanied by research on how best to communicate this very, very complex information to consumers so that they can actually make true informed decisions. The second point that I want to mention is that we're just at the beginning of what I think is a very important journey that for the first time ever, I think in the history of public health nutrition, we now have a way to identify a set of extremely unhealthy ultra-processed foods, including sugar-sweetened beverages, through the NOVA classification. There are no perfect classifications. There will always be room for improvement. There will always be some misclassification, but the epidemiological evidence that has been shared with us here and outside of this conference really shows a remarkable consistency within the US and globally on the very strong associations, negative associations between consumption of ultra-processed foods, including sugar-sweetened beverages, and quite negative, not only physical, but also mental health outcomes. So I would argue that based on this workshop, I would highly prioritize continuing and increasing the support for elucidating the mechanisms as to how ultra-processed foods affect the physical and mental health of people, with a very special emphasis on the microbiome. We didn't talk a lot about the microbiome in this workshop, but there is quite a bit of evidence also on how the microbiome is very likely to be profoundly altered by ultra-processed foods. And I will turn over the answer to Shiriki.
Thank you. So I'll preface my remarks to answer this question by saying that my first profession was as a social worker. And that always comes through when I start thinking about how we're going to make the population healthier. I have been at a conference of an organization called Transformative Consumer Research. And it was a meeting, no PowerPoints were allowed, and everybody was talking about what they thought. And I found myself saying, nobody sits down to a plate of nutrients. And listening to this workshop, I will add, nobody shops for nutrients other than supplements. So what I think that's happened is that the UPF movement, so to speak, fad, science, whatever, all of it is blended together, is a mixed blessing for sure. It has done us a favor because it's gotten the attention of people on food. So what I see is a story where, as scientists, and some of the recent slides will show that, we discovered nutrients, we discovered what it was about food that could keep people healthy. And we moved further into nutrients within foods. And it's almost like we're trying to hold the consumer's head down and say, nutrients, 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 when the consumer is looking at food. And when the consumer looks at food, it's going to be what's in the food, what's in this for me. It could be pleasure. It could be, what do I want to stay away from in terms of toxic chemicals and so forth. So I wanted to just start out by saying, and I think especially important for equity and for a diverse population, that I feel like with UPF, we're moving towards a needed paradigm shift to think more about foods, especially in knowledge translation, but in order to talk to consumers about foods and not only just the nutrients in them, we need to have research about foods as well and about that consumer interface. This is not community-based participatory research, but there are no consumers at this, speaking for consumers at this conference. Always the end consumer, end user would be considered, not the scientific end user, but the eater, so to speak. And if I could just add, the other key takeaway picks up on the need for research. I was so impressed with the model of the tobacco research centers. And I know that food is not tobacco, and there's some regulatory and other kinds of contextual issues that will never work. But the concept is important because the FDA's regulation does not take place in a vacuum. So we need research on a much broader set of things than just the things that are in that narrow regulatory space. And we need partners. NIH would be a big partner and could leverage Haines data and other data, but there are also other partners who fund research in the real world, you know, American Heart Association, whatever. So we need partners to fill in that research, plus direct some of it towards policy answers. But so that those are my two big takeaways.
I thought that FDA Commissioner Robert Califf really set the tone yesterday morning when he started out by saying that he was in Singapore last week and they were trying to figure out what to do with so many people turning 100. And then you just juxtapose that with his comment that the food we eat is a major contributor to the US having the lowest life expectancy among large high-income countries. So I think that really set the tone for how important I think reducing diet-related chronic diseases are in this country. And I, like Shriki, was really, I think one of the important takeaways is learning about the NIH FDA Tobacco Regulatory Science Program, what they've been able to accomplish, and the centers that they've built up. And I think that it's really critical to establish a similar program, the NIH FDA Nutrition Regulatory Science Program. I'd like to just make a few reflections on the ultra-processed foods session from yesterday. And I think starting out with the trans fat case study was so important because it's really an amazing public health success story. You know, you had the science, you had effective, strong national advocacy led by CSPI and Michael Jacobson, and the bold steps taken by FDA to actually ban trans fat. But it took years. Right now, with the diet-related chronic disease epidemic, we can't wait that long. And so I think that we don't have time when the ultra-processed foods are ubiquitous in the food supply. They're designed and engineered by food industry to be hyper palatable. And research is really emerging that these foods have addictive properties. But it's clear from this conference that FDA cannot do this alone, that there has to be, like I was wondering if NIH, FDA, USDA, CDC could come up with a unified plan to really look at what it would take to reduce diet-related diseases and to really build the momentum. We have the momentum now. We have Democrats and Republicans that seem to agree on one thing, and that's reducing chronic diseases and getting Americans to eat healthier. So currently, everyone's concerned about ultra-processed foods. It's in the news all the time, but there's so much disagreement among scientists about the definition we're using and the use of NOVA classification, which clearly is based only on processing and misclassifies food. So while we need an operational definition for policy and regulatory science, it's really paralyzing us from taking action. And so here we're arguing about the definition, and I'm sure this is making the food industry really happy because it's really stalling any efforts for action. So I was thinking, based on this conference, what what could we do? FDA has voluntary sodium reduction strategies in place, and the data was shown at this conference that they're working. And this really also creates a level playing field for the industry. So we already have strong science on foods that are high in fat, sugar, sodium, and that they're unhealthy. We have ample, and that's reflective in the new dietary guidelines. Well, the dietary guidelines also did not take on ultra-processed foods because they said it lacked the science. So it's going to take a while to really build that up. But we do have the science on saturated fat, sodium, and added sugars. So we already have sodium reduction strategies. So why not have FDA set added sugar and saturated fat reduction targets for processed and packaged foods? And if they're not met, then Congress mandate that, that they should be mandatory. And then could FDA also add guidance on non-essential additives like the colorants, flavors, and also think about putting more information for non-nutritive sweeteners, because right now we have no idea, as Shuwen mentioned, on the amounts. So those, I just think if we, we can start now, and we really don't have the time to wait. And I think that the work on sodium reduction targets could be a model for added sugar and saturated fats.
Great, thank you. We'll move on to the second question, and we'll start with Dr. Kumanika, and then we'll go to Dr. Story, and then we'll come back to you, Dr. Perez-Escamilla. So the next question is, what were your takeaways regarding new ideas and strategies that you heard during the workshop?
A lot of new ideas for sure. I think the idea of being much more, okay, I think the idea of being more multi-trans or interdisciplinary came up in the session on behavior change and economics at the end of the day yesterday. A lot of scientists and researchers, I think, don't feel competent to study nutrition because it's an esoteric science. So I want to pick up on the food theme again and say that more people are interested in food than they are in nutrition in other disciplines who know that work on research about consumers. And so what I'm envisioning, putting some of these ideas together, is a comprehensive research strategy that includes FDA-focused research, but other research around the context, and that brings in the disciplines who are expert in that aspect. A lot of the great experts in what consumers do are in the industry. They'd be getting a lot more money than they would get if they were working for NIH. But I think we have to just, we can't satisfy our desire to go deeper and deeper and deeper into our own weeds when the nutrition can only be improved in the population if we can get people to eat different food. And so I think that idea was bubbling up in a lot of the different presentations, and that's the one I'd like to emphasize for that question. Oh, Mary next.
Okay, so we mentioned the need for the nutrition regulatory science program, but within that, I think there needs to also be training for researchers on regulatory science. Now, the three of us, Raphael, Shriki, and I, all do policy relevant research. But when we had the pre-meeting with you, Krista, we said, can you tell us more about regulatory science? And I've talked to people here who really have do nutrition policy work, and they say, what's regulatory science? And they're not saying that in tobacco because they know what it is. And so I think that right now, if you could have FDA come up with in NIH, what are the research questions that would really move regulatory science nutrition forward? You have this whole cadre of researchers around the country that do nutrition policy research, and they're ready. But I think they're really, this whole topic is really unknown in kind of the nutrition public health community. So I think having that training, and also, as was mentioned in the talk about this, there's a need for NIH for the study sections to really understand this. But if we could have more of a focus on nutrition regulatory science based on the priorities for NIH and FDA, then you really could have a request for proposals from NIH come out, because there's really people that would love to do this research around the country and help.
Okay, so I'm glad we're coming up with three very different things, so that way we can contribute to enriching the discussion from each other. So as you know, several iterations now of the dietary guidelines for Americans, scientific committees have shown and have taken the approach of understanding the relationship between dietary intake and disease through modeling of dietary patterns versus food by food. Even at some point, it was almost nutrient by nutrient. But we do know how complex modeling dietary patterns is. And there is no doubt that artificial intelligence must and will play a role at helping us advance the dietary patterning modeling field. But as it was illustrated today with the images of the dog and the cat, the quality is still not great. And we continue to dream about a breakthrough moment where this magic dietary assessment method is suddenly going to be published, and then we will then really be able to benefit from AI. But clearly, we're still not there. And I would say that the NIH, the USDA, and other government agencies could really combine resources to support much better research. And we have amazing researchers at the National Cancer Institute. It's not like we don't have people that don't know how to do it. So I would say that that is an area where we still need profound innovations. Biomarkers are fantastic in many ways to validate definitions, validate these assessment methods. But when it comes down to cost and practical aspects, we're still going to have to rely on dietary intake patterns. So I would like also to briefly mention that we have discussed here now at length the removal of partially hydrogenated vegetable oils. We have also talked about tobacco, but for some reason, no one has brought up the wonderful story of how the decision was made about fortifying the food supply with folic acid for the prevention of neural tube defects, and how collectively all the surveillance and monitoring data that diverse agencies were doing immediately, including NHANES, started showing this is working, and it worked. So I would say that doing some level of funding, giving some level for implementation science research to retrospectively try to understand why it took a much shorter period of time to do that than the 30 years it took to do trans fatty acids. Without implementation science research, we just keep on missing those lessons, and we keep on repeating mistakes as new regulatory questions come our way.
Great, thank you so much. So we have about 12 minutes left. So I think what I'm going to do is I'm going to ask what I think is the more pressing of the two questions remaining. Then if we have time, we can jump back to the other one. So for this one, we'll start with you, Dr. Story, and then we'll move over to Dr. Perez Escamilla and then back to Dr. Kumanika. So the next question is, what do you feel are the most important areas that would move nutrition research forward?
Well, I think I
Sorry,
mentioned
nutrition.
Yeah.
Yes, nutrition research forward.
Yeah, I
Thank you.
think I've mentioned the comments, but the one thing I would say that's different is we need to invest in nutrition research. And, when you think that less than 5% of the NIH budget is for nutrition research, and I was talking to Susan Main this morning, and she said when she left 18 months ago, only 7% of the FDA budget was for nutrition. We can't get this done without having an infrastructure for more research. We need more research in clinical metabolic research. It's pathetic that we can't get Kevin Hall to do it on a much larger scale. That type of research is so needed. And I was thinking, Kevin, yesterday, what I think we need is a large facility in a rural area, and that you attract writers for a writing colony or artists who could come, and then they would probably love to be there doing their craft all day. Right. Anyone. But I think to really accelerate the research, and I think that the public health, nutrition, and health community would really be there to help advocate how we can reach Congress to really be able to really improve nutrition research.
So on my end, I think one of the most pressing issues is to address regulatory nutrition issues pertinent to the first 1,000 days of life, gestation, the first 2 years of life, and I would say, and the next 1,000 years of life, at the very least up to 5 years of age. That is the time when through epigenetic mechanisms, the organisms are getting programmed metabolically to later on in life develop obesity and all sorts of NCDs. And along those lines, I am extremely concerned about the total lack of regulation of health claims in infant formulas that we have in our country, and also the way industry takes advantage of the GRAS loopholes in terms of adding fairly bioactive compounds to those products and skipping a lot of steps because of, for example, 6 human milk oligosaccharides have now the GRAS status. So there is a whole Lancet series that we published in 2023 with thousands of references just documenting the marketing playbook, how exploitative it is, how misleading it is, and how totally out of control those health claims are. And it's both text and it's also images. And there is an international code that is supposed to regulate the ethical marketing of infant formulas that was approved by all countries in the world in 1981, except the US. And the reason it was not approved in 1981 was because of the argument of the First Amendment right from industry. So there is nothing new with that. That is the reason why it was not approved. So I would say that in my mind, as a society, as government agencies, we really need to question ourselves in terms of what is more important, to just keep the status quo, we're not constitutional lawyers, or to actually respect the human right that we all have to make decisions based on truthful information. So I don't know how you do research on that, but I would say this whole issue of exposure to massive amounts of ultra-processed foods and sugar-sweetened beverages, practically since gestation, a lot of the stuff that the mom is consuming during pregnancy ends up metabolically affecting the fetus. So that is to me a very, very important area to focus in terms of more dollars for research, but also in terms of bring much stronger regulations to protect the well-being of humans since the beginning of life.
I agree totally with that. That's just, that's a tremendous point of emphasis. I think that we can try to build trust in the government activities related to nutrition regulation. I don't think we have that trust now. And it could become worse as we don't have control over the narrative about what kinds of food people should be eating. So that's where the UPF has been a mixed blessing, because it has increased the concern about the foods we're eating, but not the certainty, because the classification is just not specific enough to be useful to consumers. I think we should have a food research agenda that combines the interests of the FDA, USDA, and other agencies with really a stake in food, because the informational approach that the FDA is allowed, as I understand it, is not enough. And the threats include the negative things that consumers are hearing about food safety issues. They don't hear about the safety. They hear about the things that get through that slip through the cracks. If we can't get the public to trust that there is someone protecting them from certain types of things, I don't think we will ever succeed in improving the nutritional health. We'll always be subject to whatever somebody said yesterday, who's more believable for some reason. And I think that's a major communication issue, and a major information disinformation issue that we need to focus on while we're focusing on the types of science that we're more accustomed to. But I don't think that the FDA has the authority to take care of all these things, which include tracking the food supply, tracking what the food industry is doing, tracking the advertising, and then translating things in a way that builds trust. And I would focus that trust, you focusing on the first part of the life course. I agree with that, and I would add we should focus on the least likely to succeed with a healthy diet across the life course, because right now, if I go to the grocery store, I'm probably the only person in the aisle in my neighborhood who turns the package over right away to see what's in it. We were told we're not normal people. And even when people, we heard one of the talks, even when people know and are told and appreciate the information, they make the decision on another basis. So even though it sounds soft from a scientific point of view, it is the hard science that's driving what people eat. And I think we need to be able to make all our wonderful, quote unquote, hard science information useful. We need to get closer to the soft side and expand that paradigm so that we can reach the consumer the way we would like to and change the diet, see that change we would like to see.
Great. Well, we only have 2 minutes left, so I think we should probably wrap up so we can let people get to their flights. And I don't think we want to round robin so quickly through any additional questions. I want to thank all of our panelists for their reflections, their insight, and sort of putting it all together at the end of 2 exciting and provocative, I guess a day and a half, exciting and provocative day and a half. And we will now turn it over to Drs. Bremer and McKinnon to summarize the workshop and bring us to a close. So thank you all very much.
Yeah, why don't we co-present? How about that? Yes. So, yeah, no problem. Just summarize a day and a half. So thank you, everybody. Thank you to everybody here in the room. So just to reflect back, the beginning of yesterday, the goal of the workshop to focus on how to conduct nutrition science and how that can generate and to inform food policy and regulatory decision-making. So what we were looking to do was to identify critical research gaps, priorities, and research resources, and then how to conduct the science in a way that then could inform food-related policy decision-making. And then as part of that, to provide specific examples of how FDA and the NIH have worked together in multiple areas in the past. So, and what we did, somebody who was it yesterday morning used the phrase master class in terms of the presentations. And I feel like actually all of the presentations we heard throughout the day and a half were really a master class in presenting complex information in a concise, compelling way. So we heard in the morning is the laying the groundwork, what the agencies do. We heard from leadership from both agencies, and then some of the specific examples with the Tobacco Regulatory Science Program, the success of partially hydrogenated oils. Most of that success happened within the first decade or so, and then continued on with the regulatory actions. And then in the afternoon, we dove into some really key areas, but hearing from different perspectives about ultra-processed foods and some of the potential areas of future investigation, and then looking at nutrition and examining both contaminants and nutrition in food, so risk analysis, as well as impact analysis and implementation science. And then today, how we might utilize resources, some that are already available, some that could be augmented, and then some, again, that are on the horizon. I don't think I'll be able to get the image of the cat and the dog out of my mind, Benoit, but thank you for that. So I think I want to end at where Drew started, actually, with gratitude.
That's where I was going to go. Yes.
Yes, that's why I went first. But really, gratitude for everyone, for Drew, for the Office of Nutrition Research, for our planning committee. Everybody who was in the planning committee participated as a moderator, either online or as a presenter. And particularly Kim Barch, who I know doesn't like to be called out, but truly it takes, as somebody has said to me before, it takes an enormous amount of work to make things look easy, and Kim makes it look easy. So thank you, Kim, particularly. Also our speakers, as I said, I mean, what we were looking to do here is to start with the end in mind, or to stimulate the thinking, to start with the end in mind, not in terms of knowing the answers, but to be asking the questions, starting with the questions in mind, knowing regulatory infrastructure, the types of questions, and the way everybody was able to pull that together was really remarkable. And to stay on time, there were no crash tackles out the door that we had to take people out. And then finally, the folks who've been joining us online, and the robust set of questions that we've had. But really, we could feel everybody outside of the room who was here with us. Apparently, we had more than 1,000 people who are registered, and including people from 17 countries. So with that, I will again end with gratitude and turn it over to my co-conspirator.
Co-conspirators,
Yes.
right? No, thankful. It's hard to echo. I do want to echo everything Robin said. One thing that we started this project, and this I want to embarrass Robin really for a second, and this concept of nutrition regulatory science and a nutrition regulatory science program, and Mary, I appreciate your comments about that. Robin's been thinking about this for years now, and we've had these conversations, and this workshop is a fruition of that, and it's remarkable. And we've talked a lot about, especially the past 2 days, what would success look like? And I have to tell you, you guys blew it out of the water. And so, the adage of starting with the end in mind, and what were we trying to achieve? The richness of the discussion, and I do want to echo, those in the room and those online. The richness of the discussion, the ideas, the comments, all those are being captured. I've taken more notes today than I did in grade school. But those are going to be actionable. And going back to the last panel, the intent of starting with the end in mind and what does success look like is to take the richness of these discussions and go back home and think about how to move that from this discussion to something that's actionable, that's going to make an impact and improve public health. Because at the end of the day, that's our goal. Solution focused, knowing how to navigate systems, tapping on experts for advice and guidance, and then doing something, and then reevaluating, and then doing more. It's been said many times, time is of the essence, and we agree. And the fact that more than 1,000 people are registered, we have many hundred online, we have a full room here, echoes the import of what this conference was aiming to do and what we want to do as public health servants. So I had the privilege of starting yesterday. I had the privilege of staying on time and ending today, but I don't take that privilege lightly. And I want to once again thank the Office of Nutrition Research. It is a small but mighty team. They're all here today, and I appreciate that. And I will echo, without Kim, none of this happens. And so, Kim, I know you don't like being called out, but I will call you out too, because I personally would not be able to function without you. So I appreciate that. And to all of you, we are now 1 week away from Christmas, that the holidays are upon us, very close to a new year. And I want to express gratitude to you. I wish you and your families nothing but the best. Please, during this time, take time for yourselves too. This is a journey. Thank you for being on this path with us, but please also take care of yourselves along the way. And with that, I think we will officially close it. We're going to close it early, on budget and early. So there you go. Thank you all.